Hello, I am Captain Cynthia Gunderson, Chair of the Indian Health Service National Committee on Heroin, Opioids, and Pain Efforts, or the HOPE Committee. The overall mission of the IHS is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level, grounded in the bedrock foundation to uphold the federal government's obligation to promote healthy communities and to honor and protect the inherent sovereign rights of tribes. The IHS HOPE Committee works with tribal stakeholders to support the IHS opioid strategy, which aligns with the IHS strategic plan and provides a framework for opioid response activities and recommendations to be achieved at the local level. The strategies are informed by opioid stewardship best practices and evidence-based clinical recommendations. The IHS opioid strategy and HOPE Committee is all about fostering tribal relationships, and we focus on supporting and strengthening local resources, developing and sharing best and promising practices for care coordination, building clinical capacity through training and workforce development, and engaging in meaningful discussions related to substance use disorder treatment and recovery. The goals of the IHS HOPE Committee are to promote appropriate and effective pain treatments, to improve access to culturally appropriate care, and to reduce overdose deaths from heroin and prescription opioid misuse. You can find out more about the HOPE Committee by using the resources linked below this video. I am not an OIG employee, yet I am pleased to have this opportunity to participate in this important program on opioids and the impact to tribal communities. In this video, we will highlight specific steps the IHS is taking to address the opioid crisis, including actions you yourself might consider taking. I think we can all agree that opioid misuse has devastating impacts on communities. Addressing the opioid epidemic is one of our top priorities within IHS. The IHS opioid strategy emphasizes patient and family engagement in treatment planning, targeted workforce development strategies, and use of clinical decision support tools that can help prescribers and health systems to implement best practices and to identify additional opportunities for performance improvement. The IHS opioid strategy has 5 major aims: to expand access to prevention, treatment, and recovery services, expand harm reduction interventions, including improving access to opioid overdose reversal medications, developing comprehensive interdisciplinary approaches to improve management of acute and chronic pain, to reduce the impact of perinatal substance exposure on future generations, and develop better data extraction methods and metrics to support informed decision-making regarding pain management and opioid use disorders. Let's talk about each of these in turn. For even more information on our initiatives, we recommend that you refer to the IHS Opioids website linked below. The first aim of the IHS opioid strategy is prevention, treatment, and supporting recovery. Opioid use disorder is a chronic disease with available treatment, and long-term recovery is possible. Prescribers and health systems have a critical responsibility to protect patients and communities from this disease. This all starts with prevention and education. Education focuses both on appropriate treatment of pain syndromes and opioid use disorder. The IHS Essential Training in Pain and Addictions and other module-based learning are the foundations of the IHS workforce development resources. Listed below in the resources section are a number of courses developed and recommended by Indian Health Service. Other prevention efforts are also possible. The IHS has several grantees creating and evaluating promising practices related to substance use disorder. A link to these initiatives is located below. In the way of example, the Clinton Service Unit has been partnering with their local sheriff department for years on prescription drug take-back events. These events have promoted medication safety for the community while increasing awareness of the opioid epidemic. Improving access to opioid use disorder treatment and recovery is also a key area of focus. Across IHS, we are working with clinicians to support trauma-informed and patient-centered care for patients with an opioid use diagnosis. The IHS is also committed to improving access to medications for opioid use disorder, or MOUD, when clinically appropriate. All IHS facilities are required to identify local treatment programs for patients to improve access to medications for opioid use disorder. The IHS policy statement requires federal IHS sites to create an action plan to identify local treatment resources and coordinate patient access to these services. Below this video, you can find links to these resources. A variety of recovery resources for providers are also available on this website. One specific initiative worth noting is our collaboration with the Substance Abuse Forum Line, which offers on-demand clinician-to-clinician support for providers managing alcohol and substance use disorder. Tele-MAT. IHS has been working to expand MOUD locations so patients can start recovery faster and lower the risk of return to illicit substance use. Several IHS areas and facilities are creating tele-MOUD services that provide access to MOUD where resource constraints have made it difficult to establish or maintain local services. The second aim of the IHS opioid strategy includes harm reduction initiatives. While working hard to prevent opioid misuse and coordinate or provide holistic care for opioid use disorder, it is important to continue to support access to overdose reversal medications such as naloxone. Naloxone saves lives. When given right away, it can work in minutes to reverse an opioid overdose. Naloxone is safe, has few side effects, and some forms can be given by friends and family. Within IHS, there are several important areas of focus to increase harm reduction interventions. Providing education and training for law enforcement and first responders on naloxone and when and how it can be used. I encourage you to become familiar with several important resources, all of which are linked below. The IHS is also collaborating with stakeholders to record virtual train-the-trainer curriculums to support community-based naloxone distribution programs. The IHS is also working to expand models for pharmacists to co-prescribe naloxone for patients and families of individuals at risk for opioid overdose. The third aim of the IHS opioid strategy is the management of acute and chronic pain. To address the opioid epidemic, we need to find the right balance between reducing the suffering of chronic pain patients and reducing the risk of opioid addiction. To do this, we want to make sure our providers and patients are well informed and able to support evidence-based pain management strategies that improve patient outcomes. The IHS is helping healthcare providers and systems of care to put evidence-based prescribing practices in place, including providing the Pain and Opioid Use Disorder webinar series. In addition, the essential training on pain and addictions, also linked below, is required for all IHS federal prescribers, contractors, clinical residents, and trainees within 6 months of employment, and a refresher training must be completed every 3 years. The fourth aim of the IHS opioid strategy includes addressing perinatal substance exposure. Efforts to address the opioid epidemic must also consider future generations, including screening for substance use disorder among pregnant women and women of childbearing age, and providing appropriate support and medications for opioid use disorder, if clinically appropriate, for pregnant women. Once again, education and awareness are essential. The IHS is sharing 2 key clinical practice recommendations. The first being the American College of Obstetricians and Gynecologists, or ACOG, recommendations to the Indian Health Service on American Indian or Alaska Native pregnant women and women of childbearing age with opioid use disorder. The aim of this guideline is to increase screening for substance use disorder across the reproductive life cycle, relating to substance use disorder as a chronic condition that can be successfully managed with medications and behavioral support, supporting early access to medications for opioid use disorder, treating mothers and infants as a dyad to reduce impact of neonatal opioid withdrawal syndrome. The second clinical recommendation is from the American Academy of Pediatrics, or AAP, titled Recommendations to the IHS on Neonatal Opioid Withdrawal Syndrome. This resource helps providers to improve identification, care, and outcomes of infants at risk for NOWs. The recommendations were developed based on critical feedback the IHS received on the importance of perinatal opioid exposure in opioid listening sessions and tribal consultations. Please see the below resources and additional training on screening and medical management of opioid use disorder in pregnant and parenting women. Another critical element of the IHS perinatal opioid intervention is increased access to high-quality home visiting services for families affected by substance use disorder. Family Spirit is an evidence-based, culturally tailored home visit intervention delivered by community health representatives as a strategy to support young Native families who have infants and children ages 0 to 3 years old. You can learn more about this program in the link below. Additionally, the IHS has announced plans to expand the Community Health Aid Program, or CHAP. Finally, the fifth aim of the IHS opioid strategy is using better data for informed decision-making. Recognizing the power of data to help in the fight against opioids, IHS has also invested in monitoring and opioid prescribing surveillance tools. The IHS has developed an interactive opioid prescribing dashboard that includes a set of 6 opioid prescribing metrics to assist with the analysis of opioid-related data on national, regional, and local levels. The data will be used to evaluate population outcomes, target opioid interventions, enhance clinical decision support, and create professional practice evaluation strategies. An additional 9 measures are planned in Phase 2. Other important actionable data are available through state prescription drug monitoring programs, or PDMPs. The IHS Chapter 32 outlines the requirements for IHS prescribers and pharmacists to access the appropriate PDMP at specific times in the course of caring for patients receiving controlled substance prescriptions. These electronic databases track controlled substance prescriptions within and beyond the IHS to help identify patients who may be misusing prescription drugs and may be at risk for overdose. Enroll in the PDMP database in your state and be sure to use it with every patient encounter prior to issuing a controlled substance prescription. Becoming familiar with and using these various data sources and tools will help to focus priorities for improvement and drive appropriate action at the local level. The IHS's 5 priority strategies offer a multi-pronged approach to better understand and respond to the opioid misuse and abuse. Given current trends, we cannot afford to lessen our collaborative efforts to address this crisis. Each of us can make a difference in the fight against opioids. If you are not already, consider how you might champion this important cause in your community or facility. I encourage you to get and stay informed, including taking advantage of the many trainings available on this topic. Also become familiar with the many resources that have been developed to support assessment and action planning and to improve access to prevention, treatment, and recovery services. Complete training on opioid overdose reversal and carry naloxone. You never know when you may be called to save a life. Engage in opioid stewardship activities at the local level and promote patient-centered care plans. And finally, subscribe to the IHS Opioids newsletter and listserv to stay connected. Thank you for all that you do to promote the IHS mission and improve outcomes for patients and communities.